You did everything right yesterday. You watched what you ate. You took your medication exactly on time. You skipped the bread at dinner. You drank your water. You went to bed feeling like today was a good diabetes day, maybe even a great one. You checked your blood sugar before bed and it was 118, maybe 122, right where it should be. Then you woke up this morning. You shuffled to the bathroom, grabbed your glucometer, pricked your finger the way you have done 1,000 times, and the number on that screen stopped you cold. 158, 171. One morning last week it was 184. And you stood there in your bedroom slippers, in the quiet of early morning, holding that little machine, and you thought, what did I do wrong? You did not do anything wrong. But something is happening inside your body every single night that your doctor may have never fully explained to you. And after today, you are going to understand exactly what it is, exactly why it happens more powerfully after age 60, and exactly what you can do about it starting tonight. My name is Dr. Ava, and I am a senior health educator with a focus on metabolic conditions in adults over 55. Today we are talking about one of the most frustrating, most confusing, and most misunderstood experiences in diabetes management: waking up with higher blood sugar than you had when you went to sleep. There are two specific mechanisms responsible for this, and they have names: the dawn phenomenon and the Somogyi Effect. Most people living with diabetes have never been told about either one. Some have heard the words, but were never given a real explanation of what is actually happening inside their body while they sleep. By the end of this video, you are going to know what triggers each one, how to tell which one you are experiencing, and the 4 specific things you can do tonight to lower that morning number starting tomorrow. I will give you exact times, exact strategies, and exact signs to watch for. This information is important for every diabetic, but it is especially critical if you are over 60 because the biology of aging makes both of these mechanisms significantly more powerful in your body than they are in a younger person. Stay with me. Every minute of this video matters. Before we go any further, I want to meet you where you are. Drop your city or your country in the comments right now. It takes 5 seconds, and it means the world to this community. Whether you are watching from Texas or Toronto, from the United Kingdom or Uganda, from the Philippines or Pakistan, type it below. I read every single comment, and it helps me know where to focus future videos. Type your location right now while we continue. Let us start with the first and most common reason your blood sugar rises overnight. It is called the dawn phenomenon, and once you understand it, you will never look at your morning number the same way again. Here is what is happening. Between approximately 2 a.m. and 8 a.m. every morning, while you are sound asleep and have not eaten a single thing, your body begins preparing for the day ahead. It does this through a completely automatic, completely normal biological process. Your brain sends signals to your adrenal glands to begin releasing a specific set of hormones. These are called counter-regulatory hormones, and the main ones are cortisol, glucagon, growth hormone, and epinephrine, which you may know as adrenaline. These hormones have one primary job in the morning: to give your body the energy it needs to wake up, stand up, and function. They do this by signaling the liver to release stored glucose into the bloodstream. Think of it like a fuel truck arriving at a construction site every morning before the workers show up. The body is pre-loading glucose into your blood so that energy is ready the moment you need it. In a person without diabetes, this works perfectly. The rising glucose triggers an automatic release of insulin from the pancreas, which immediately brings the blood sugar back into range. The system is self-correcting. But in a person with type 2 diabetes, especially an older adult, this system has 2 serious problems. Problem 1, the pancreas either cannot produce enough insulin to respond to that morning glucose surge, or the body's cells have become resistant to the insulin that is produced. So the glucose that the liver released simply sits in the bloodstream with nowhere to go. Problem 2, as we age past 60, the counter-regulatory hormone release, particularly cortisol, becomes more pronounced and more prolonged. Research has documented that older adults experience a longer duration of the cortisol morning surge compared to younger adults. This means the liver is releasing glucose for a longer window of time. More glucose released, less insulin response available, higher morning blood sugar. Here's the analogy I want you to hold in your mind. Imagine a city water department that every morning automatically opens a valve and floods the pipes with extra water pressure to prepare for the day. In a well-maintained building, the pressure relief valves handle this automatically, but in an older building with worn-out relief valves, the pipes cannot regulate that pressure. Water floods where it should not. That is your bloodstream every morning. The city is your hormonal system. The worn-out relief valve is your impaired insulin response. The dawn phenomenon is not caused by anything you ate. It is not caused by skipping medication. It is not caused by stress or poor choices. It is a hardwired biological process that happens in every human body every single night. It just has a greater and more visible impact in diabetics over 60 because of two converging factors: impaired insulin function and amplified hormonal response with age. This is not your fault. Your hormonal system is doing exactly what evolution programmed it to do. Your pancreas and your cells are working within their current biological limitations. Understanding this is what allows you to work with it instead of being blindsided by it every single morning. Now here is the plot twist, and I need you to pay very close attention to this section, because this is where meaning doctors sometimes get confused, and where the wrong response can actually make your blood sugar worse. There is a second reason diabetics wake up with high morning blood sugar, and it works in almost the opposite direction from the dawn phenomenon. It is called the Somogyi Effect, named after Dr. Michael Somogyi, the researcher who first described it in the 1930s. It is also sometimes called rebound hyperglycemia. Here is what happens. In some diabetics, particularly those on insulin or certain oral medications, like sulfonylureas, the blood sugar does not gradually rise during the night. Instead, it drops. It drops low, sometimes dangerously low, in the middle of the night, usually between midnight and 3 a.m. This is called nocturnal hypoglycemia, and the terrifying thing about it is that most people sleep right through it without ever feeling it. When the body detects that blood sugar has dropped too low, it triggers an emergency response. The adrenal glands flood the system with those same counter-regulatory hormones we discussed: cortisol, glucagon, epinephrine. But this time, they are not slowly preparing you for morning. They are responding to what the body perceives as a life-threatening energy crisis, so they overcorrect massively. The liver dumps a huge surge of glucose into the bloodstream, far more than is needed, and blood sugar rebounds dramatically. By the time you wake up and check your glucose, you see a high number, and you assume the problem was too much glucose all night, when in reality, the problem was too little glucose in the middle of the night, followed by a violent overcorrection. This is critical because the wrong response to this is to increase your medication dose or reduce your evening carbohydrates further, which makes the nighttime low even worse the next night, which causes an even bigger rebound, which raises your morning number even more. It is a dangerous cycle that looks like uncontrolled diabetes, but is actually caused by over-treatment. I am going to show you exactly how to tell which one you have. But first, let us talk about the symptoms that send people in completely the wrong direction. Here are 4 symptoms that accompany these overnight blood sugar shifts, and the dangerous mistakes that come with each one. The first symptom is waking up feeling tired despite a full night of sleep. This is the one that fools almost every diabetic senior, because the automatic assumption is that you are just getting older or that you did not sleep well. The tiredness feels like normal aging fatigue, but persistent morning fatigue in a diabetic over 60 can be a sign that your blood sugar was either high all night, which forces the kidneys to work overtime processing excess glucose and causes cellular energy deficits, or that it dropped low during the night, triggering a stress hormone surge that disrupted your sleep architecture even if you did not consciously wake up. The dangerous mistake is dismissing morning fatigue entirely and never connecting it to overnight blood sugar behavior. The corrected action: for the next 7 days, rate your morning fatigue on a scale of 1 to 10 immediately after waking, before any coffee or activity. Log it alongside your morning blood sugar reading. Pattern recognition over 1 week will reveal whether your fatigue and your glucose numbers are moving together. The second symptom is morning headaches, especially at the front or sides of the head. People assume morning headaches are from dehydration, poor pillow position, or high blood pressure, and sometimes they are. But a consistent pattern of waking with a headache in a diabetic can signal that blood sugar was elevated all night. Sustained hyperglycemia causes the body to pull fluid from cells in an attempt to dilute excess blood glucose. And this cellular dehydration is a documented cause of headache. The dangerous mistake is taking pain medication for the headache without checking blood sugar first, then eating a carbohydrate. Heavy breakfast to feel better, which spikes an already elevated morning glucose even higher. The corrected action: when you wake up with a headache, check your blood sugar before reaching for any pain relief. If it is above 140, the headache may be glucose-related. Drink 12 ounces of plain water, take a 10-minute walk, and recheck in 30 minutes. The third symptom is night sweats, and this is the one that looks like a completely different condition. In adults over 60, especially women, night sweats are almost universally attributed to menopause or to the hot flashes that can persist for years after menopause. Men often attribute them to room temperature or heavy blankets. But night sweats are also a classic symptom of nocturnal hypoglycemia, the nighttime low blood sugar that causes the Somogyi rebound. When blood sugar drops too low during sleep, the body activates its emergency stress response, which includes sweating as part of the adrenaline surge. This means a woman who has been told her night sweats are just hormones for 2 years may actually be experiencing dangerous overnight blood sugar lows that have gone completely undetected and untreated. The dangerous mistake is assuming night sweats are always hormonal in a diabetic woman over 60 and never investigating blood sugar as a cause. The corrected action: the next time you wake up sweating, check your blood sugar immediately before doing anything else. If it is below 80, you are experiencing nocturnal hypoglycemia, and you need to discuss your medication timing and dosage with your doctor as soon as possible. The fourth symptom is increased hunger in the morning, even after eating dinner the night before. People assume they are just hungry because they slept a long time without food. But excessive morning hunger in a diabetic, particularly when accompanied by shakiness, light-headedness, or difficulty concentrating, can indicate that blood sugar dropped overnight and the body is now urgently signaling for glucose. The dangerous mistake is eating a large, fast, digesting carbohydrate breakfast in response to this hunger, which creates a dramatic morning glucose spike on top of an already disrupted overnight pattern. The corrected action: eat a breakfast that combines 15 to 20 grams of slow, digesting carbohydrate with at least 20 grams of protein. Examples include 2 eggs with 1 slice of whole grain toast or plain Greek yogurt with a small handful of walnuts and berries. I need to be completely honest with you in this section because the stakes around overnight blood sugar in diabetics over 60 are real and they are serious. Here is how this condition escalates across 3 stages if it goes unaddressed. Stage 1 is the pattern of silent damage. During this stage, blood sugar is elevated every morning, often between 140 and 180, and the person feels tired, a little foggy, and vaguely unwell, but attributes it to age. Nothing dramatic is happening yet. But every morning that blood sugar is elevated, glucose molecules are attaching to proteins throughout the body in a process called glycation. The walls of small blood vessels are being slowly stiffened. The nerves supplying the feet and hands are being quietly damaged. The filters inside the kidneys are working under increased strain. This stage can last years with no obvious symptoms, while significant internal damage accumulates. Stage 2 is the emergence of complications. This is when the damage from stage 1 becomes visible and measurable. The patient begins experiencing tingling or numbness in the feet. Early diabetic neuropathy. A kidney function test reveals that the GFR, the glomerular filtration rate, has declined. An eye exam detects early changes in the retinal blood vessels. Blood pressure that was well controlled begins to climb. Cholesterol ratios shift unfavorably. At this stage, the complications are real and present, but they are still manageable with aggressive intervention. Stage 3 is advanced systemic involvement. This is the stage we are working to prevent entirely. At this point, neuropathy has progressed to the point of affecting balance and increasing fall risk. one of the leading causes of serious injury and loss of independence in adults over 65. Kidney function may have declined enough to raise discussions about dialysis. Cardiovascular risk is significantly elevated. Vision may be affected by diabetic retinopathy. And the compound effect of years of disrupted overnight blood sugar, never addressed because no one explained the dawn phenomenon or the Somogyi effect, has quietly driven this progression forward. Go to your doctor immediately if you experience any of the following. First, a fasting morning blood sugar above 200 on 2 or more consecutive days. Second, episodes of waking at night feeling shaky, confused, or with your heart racing. Third, numbness, burning, or loss of sensation in your feet that has appeared or worsened in the last 30 days. Fourth, blurred vision in the morning that takes more than 15 minutes to fully clear. Fifth, unexplained weight loss of more than 5 pounds in 1 month without dietary changes. Sixth, extreme thirst and frequent urination overnight that is new or worsening. Now I am going to give you the 4 specific things you can do starting tonight. Follow these steps in order. Step 1. Set an alarm for 2 a.m. for the next 3 nights and check your blood sugar. I know that sounds disruptive, but this single action is the most important thing you can do because it is the only way to determine whether you have the dawn phenomenon or the Somogyi effect. Here is what the numbers tell you. If your 2 a.m. blood sugar is normal or elevated, above 100, and your morning reading is high, you have the dawn phenomenon. Your body is producing too much counter-regulatory hormone response. If your 2 a.m. blood sugar is low, below 80, and your morning reading is high, you have the Somogyi effect. Your medication is dropping you too low at night, and your body is overcorrecting. Write these numbers down and bring them to your doctor. This information will directly guide your treatment adjustment. Step 2. Change your dinner timing and composition tonight. Eat your last meal of the day no later than 7 p.m. Make sure that meal includes a source of slow-digesting protein and fat, alongside any carbohydrates. Good examples include baked salmon with roasted vegetables and a small portion of brown rice, or a chicken and vegetable stir-fry with olive oil over cauliflower rice. The protein and fat slow gastric emptying and reduce the speed at which glucose enters the bloodstream overnight. Avoid eating any starchy carbohydrates, bread, pasta, white rice, potatoes, after 6 p.m. These digest quickly and can cause a glucose spike followed by a drop during the night, which in medicated diabetics can trigger the Somogyi rebound. Step 3. Add a 10-minute walk immediately after dinner every single night. This is not about burning calories. This is about activating a specific biological mechanism. When large muscle groups in your legs and core contract during walking, they can absorb glucose directly from the bloodstream without requiring insulin. This is called non-insulin-mediated glucose uptake, and it is one of the most powerful tools a diabetic has. A 10-minute walk after dinner has been shown in multiple studies to reduce post-dinner glucose spikes by up to 22% compared to sitting. Lower post. Dinner glucose means lower starting glucose going into the night, which means less dramatic overnight swings in either direction. Step 4. If your 2 a.m. readings confirm the dawn phenomenon, discuss with your doctor the option of taking your long-acting medication or your metformin dose at bedtime rather than in the morning. For many diabetics, shifting the timing of medication from morning to night provides coverage precisely during the window when the hormonal surge is driving glucose up. This is a medication timing adjustment, not a dose change, and it has helped thousands of diabetic seniors reduce their morning numbers without any additional medication. Never adjust your medication timing on your own without discussing it with your doctor first. But go into that appointment informed, with your 2 a.m. readings in hand, and ask this specific question. Would shifting my medication timing to bedtime help address my dawn phenomenon pattern? I want to pause here and ask you something directly. In the comments below, type the word dawn if after hearing this explanation, you believe the dawn phenomenon is what you have been experiencing. Type the word Somogyi if the nighttime low followed by a morning rebound sounds more like your pattern. And if you are honestly not sure yet, type the word checking, because that means you are going to set that 2 a.m. alarm tonight and find out. I want to see those comments below. This matters. Now let us talk about the 5 long-term habits that protect your overnight blood sugar for the rest of your life. Habit 1. Eat a small protein based snack before bed if your bedtime blood sugar is below 120. A consistent pre-sleep snack of 15 to 20 grams of protein with minimal carbohydrates stabilizes blood sugar through the early part of the night and reduces the likelihood of the Somogyi triggering drop. Good options include 2 tablespoons of natural almond butter on 1 small celery stalk, half a cup of plain cottage cheese, or 1 hard boiled egg with a few slices of cucumber. The protein provides a slow, steady amino acid supply that supports overnight metabolic stability without spiking glucose. Implementation tip: prepare your bedtime snack at the same time you prepare dinner so that decision-making fatigue does not lead you to skip it or grab something high in sugar instead. Habit 2. Practice a 5-minute resistance exercise routine every morning immediately after waking and before breakfast. Resistance exercise. Even gentle bodyweight movements like standing wall push, ups, seated leg extensions, or light resistance band work activates muscle glucose uptake and can meaningfully reduce the impact of the dawn phenomenon hormonal surge. You are essentially giving the liver's released glucose somewhere to go before it builds up in your bloodstream. Implementation tip: place your resistance band on your bedside table the night before, so it is the first thing you see when you wake up. 5 minutes is all it takes. Start with 2 sets of 10 seated leg lifts and 2 sets of 10 standing wall push. Ups and build from there. Habit 3. Drink 8 ounces of water with a 1/4 teaspoon of cinnamon stirred in every morning before your first meal. Cinnamon contains bioactive compounds, particularly cinnamaldehyde and chromium, that have been shown in multiple peer-reviewed studies to improve insulin sensitivity and slow the rate of gastric glucose absorption. It is not a medication and it is not a substitute for prescribed treatment, but as a consistent daily habit, it contributes to improved glucose regulation over time. Implementation tip: mix the cinnamon into warm water rather than cold, as it dissolves more completely. Ceylon cinnamon, sometimes called true cinnamon, is preferred over cassia cinnamon for daily use, as it contains lower levels of coumarin, a compound that in very high doses can affect liver function. Habit 4. Get your cortisol, disrupting sleep habits under control with one specific nightly ritual. Cortisol, the primary driver of the dawn phenomenon, is directly worsened by poor sleep quality and irregular sleep timing. Every night of disrupted sleep amplifies your morning hormonal surge and raises your fasting glucose. The single most effective sleep habit for cortisol regulation is maintaining a consistent sleep and wake time 7 days a week, within 30 minutes of the same time every day, including weekends. Your cortisol rhythm is anchored to your circadian rhythm. Irregular sleep times break that anchor and cause cortisol to spike earlier and higher. Implementation tip: set a phone alarm not just for waking up, but for beginning your wind-down routine 60 minutes before your target sleep time. Dim the lights, turn off news programs, and avoid checking blood sugar readings or health apps during that final hour. Anxiety about numbers activates cortisol and disrupts sleep onset. Habit 5. Ask your doctor to test your HbA1c every 3 months rather than every 6 months, and keep a written glucose log that includes both your bedtime and fasting morning readings side by side. The difference between your bedtime reading and your fasting morning reading is called your overnight glucose delta, and tracking it consistently over weeks gives you and your doctor the clearest possible picture of what is happening during sleep. A consistently rising overnight delta, where morning is regularly 30 or more points higher than bedtime, is documented evidence of the dawn phenomenon and justifies a medication timing discussion. A wildly variable delta, sometimes higher, sometimes lower, may suggest the Somogyi pattern. Implementation tip: use a simple paper log rather than a phone app. Write 4 columns: date, bedtime reading, morning reading, and the difference between them. Bring this log to every doctor appointment. It is the most valuable piece of information you can walk in with. Let us bring everything together. 3 things I need you to remember from today. First, waking up with higher blood sugar than you had at bedtime is not a personal failure. It is a physiological process with a name, a mechanism, and a solution. The dawn phenomenon is your hormonal system doing its morning job in a body where the insulin response can no longer keep up. The Somogyi Effect is your body overcorrecting after a dangerous nighttime low. Both are real. Both are manageable. And now you know the difference. Second, the 2 a.m. blood sugar check is the single most important thing you can do this week. It is the key that unlocks your specific pattern. Without it, you are guessing. With it, you have real data that can guide a real conversation with your doctor and lead to a real adjustment that changes your morning numbers starting within days. Third, the 4 steps I gave you tonight: eating dinner by 7 p.m. with protein and fat, walking 10 minutes after dinner, checking your 2 a.m. reading for 3 nights, and asking your doctor about medication timing. These are not vague lifestyle suggestions. They are specific, evidence-based actions that address the actual biological mechanism driving your morning glucose. Start tonight. You are not powerless in this. You are informed now, and informed patients get better outcomes every single time. If this video helped you understand something that you have been confused or frustrated about for months or years, please hit the like button right now. It takes 1 second, and it tells YouTube to show this information to other diabetics over 60 who need it just as much as you did. Subscribe to this channel if you want to keep getting this level of depth and honesty about the conditions that matter most to your health after 60. Share this video with one person you know who is managing diabetes, because the information in this video could genuinely change their morning, their numbers, and their long-term health trajectory. And in the comments below, tell me, what was your fasting blood sugar this morning? Just the number. That is it. I want to see it. I want this community to see they are not alone. And tomorrow morning, after you try even one of these steps tonight, come back and tell me if your number was different. I will see you in the comments, and I will see you in the next video.